Good afternoon, everybody. My name is David Tucek, and I am the U.S. Sales Director with Erchonia Corporation. On this webinar, I'm accompanied by my good friend and colleague, Mr. Travis Sammons, who is the Clinical Affairs Manager for Erchonia. We are super pumped about today's webinar. It's something that we've been wanting to do for quite some time in regards to breaking really down the difference between Erchonia Corporation and our competition. Travis and myself, we talk about this pretty much all day, every day in regards to the different devices that are on the market, the processes and procedures to ultimately get a device on the market to ramp up that specific marketplace. And in today's webinar, what our main goal is ultimately to give you guys a look behind the curtain of what we talk about and what we see every single day here at Erchonia due to the things that we do in regards to the FDA clearances, the clinical studies, the sales, the marketing aspect of it. So we hope you guys enjoy this webinar as much as we did going through it. We put some time into some slides and ultimately want to give you guys the best and most edification in regards to this specific industry and the products within. So during today's webinar, if you could back it up once, during today's webinar, a few of the things we're going to discuss is what an actual FDA 510K market clearance is and why that's important to you guys as physicians and practitioners out there. How to search public websites to find the truth about the laser therapy product you are looking to purchase. During this entire webinar, we have done the best that we can to include references for every single website, every single thing that we've come across, so that you guys can do the research for yourself. We are a company, Erchonia Corporation, and we're talking about other companies on the market. So we understand you cannot take our word for it. You cannot take our competitors' words for it. You have to do the research for yourself. So we hope that during this webinar, you actually go through and you do the research before making a large investment into laser therapy. A couple of the websites that we're gonna guide you guys through and how to search them, because they're a little bit difficult to search, is www.fda.gov and www.clinicaltrials.gov. Also, we're gonna talk about what laser classification actually means, the difference in the level of research being done by different companies, as well as physicians out there, and the competitor breakdown and comparison. Now, depending on how long this webinar goes, we are going to have a Q&A afterward. If you guys have questions throughout, you can certainly type them into the chat box on the right side. We will try to answer them throughout, but most likely, because we do want to get through all of our competitors today, we probably won't answer those until the very end of it. Now, we spoke with our entire sales team and international partners to get a feel for all of the main so-called competitors out there so that we knew what to focus on. Unfortunately, as we started digging into this, we were only able to get through 7 competitors in the marketplace as of right now. Depending on the feedback from this webinar, we can certainly do more webinars with more feedback, but as Travis and I will get into it, once you know the basics about one of these companies that are out there, you really know it's kind of the same thing with all of the companies. As a disclaimer, we have made, Travis and myself, when we went through this, made every attempt to ensure the accuracy and reliability of the information provided in the webinar. Website citations and references have been added as references on the bottom of each page. However, it is advised for every physician to complete his or her own research. So first, what we want to dig into is laser classification. Now, throughout the years being in sales, I have gone to numerous amounts of trade shows and conferences where there's a lot of different laser companies out there. One of the things that these laser companies, from what I've heard, speaking with these different companies, the representatives at these companies, is they talk about laser classification as if it correlates to the quality of the laser or as if it correlates to the research that was put into it, which is completely a false statement. Laser classification is something that was put forth by the FDA, and ultimately it is to let consumers and physicians know the possible dangers with the laser that they're looking to use on their patients. So this is 100% about safety. It has nothing to do with research. It has nothing to do with quality. It is a safety classification that was set up by the FDA. So I'll go through them really quickly. There is a total of 5 laser classifications set forth by the FDA. Class 1 laser is considered non-hazardous. Hazard increases if viewed with optical aids, including magnifiers, binoculars, and telescopes. A class 2 laser, which is what Erchonia is, hazard increases when viewed directly for long periods of time. Hazard increases if viewed with optical aids. So the main hazard with an Erchonia laser is optically. Obviously, that's why we include safety glasses with our devices. because you never want to shine that laser directly in your eyes. There is that optical hazard in place. A class 3A laser, depending on power and beam area, can be momentarily hazardous when directly viewed or when staring directly at the beam with an unaided eye. Risk or injury increases when viewed with optical aids. A class 3B, which we will be discussing 1 or 2 class 3Bs during this webinar, immediate skin hazard from direct beam and immediate eye hazard when viewed directly. And then the last classification is a class 4 laser, which is the majority of all laser devices out there and so-called competition for Erchonia. The majority of them are all class 4 systems. So the laser classification set forth by the FDA for them in regards to the product hazard is immediate skin hazard and eye hazard from exposure to either the direct or reflected beam. It may also present a fire hazard. This is nothing that Erchonia is stating. You can see the reference on the bottom of the page. This is public information. You guys can research it for yourself. So I want to give a better clarification of what actual laser classification is. Now, next, what I want to talk about, or what we want to talk about, go into, is I would like to formally introduce Travis Sammons. He's going to discuss a little bit about the FDA processes and procedures. So Travis has been with Erchonia Corporation for over 10 years, and he works directly with our president and owner, Steve Shanks. And he's the one who deals with the FDA. He's the one who deals with our clinical investigators to ultimately manage our clinical affairs department. So he has a great insight to this, and he's got some awesome information for you guys. So Mr. Sammons, if you would please.
Awesome. Thank you, Dave. And I really appreciate the topic you chose here. And it was eye-opening going through these websites and looking at it from a research perspective on what is being introduced out into the market and perceived out there. So research, it's a great tool, but that's if it's used correctly. And I'll kind of explain the more we go through this presentations of examples where it's used totally out of context. And then as Dave already mentioned, all this information we're providing today is to the very best of our knowledge. I understand there's many opinions on laser therapy. What we're stating today is based on facts, our published data. So that's why we put the citations on the bottom of each page. I'm always open to new research. So at the end of this presentation, I'm going to provide my personal information. So if there's something you just want to send to me as review, or if there's something you feel like I missed, please do. I'll make sure to answer you. The first topic, though, that I think we should touch on is FDA and what it means to be FDA cleared or FDA 510K. It's the same exact verbiage in the same meeting. So there's a lot of misconception out there what an FDA clearance means. I used to be in sales before the clinical research portion. A lot of people would come up to me, oh, that's neat that you guys are proven safe to treat low back pain. That is incorrect, and it's only half of what it takes to get FDA clearance. You have to prove the device is safe and effective. FDA 510K also is what the company and the doctor can legally market for. Dave's going to touch on that throughout this presentation. There's 2 different ways to get a 510K. Substantial equivalence, which means there's no clinical data required. You're just filing the same specs of your device off another device. And then you can apply for a new indication for use, which is the second way, but that does require clinical data, and that is the route that Erchonia takes, as we'll show you here in a few slides.
Now, Travis, going back one thing, and just a quick question, because sure. I know from a sales standpoint, we've had doctors that ask us, well, what's the difference between FDA clearance and FDA approval? I know you and I have chatted about it, but and I know it's quick and easy, but just if you would let our audience know, please.
Yeah, it's a good question, Dave. So basically, FDA approved is going to apply more so to drugs. So anything that's high risk or a class 3 device has to go through the FDA approval process. If you look at Erchonia, we actually submit de novo. This may be out there for you guys that are not used to dealing with the FDA, but basically that puts you in the FDA approval process. So they're going to audit your data, but once they figure out the device is safe, it drops down to a class 2, and at that point you're FDA cleared. So FDA approval is more so drugs. FDA cleared is going to be your devices.
Perfect, thank you.
So within laser therapy, there's 2 different categories within the pain indications for FDA clearance. The first is ILY. So this category started way before 1976, and it was heat lamps. Then you started having diathermy biosubstantial equivalent off the heat lamps based on creating heat. So in 2003, class 4 lasers or hot lasers started biosubstantial equivalents based on therapeutic heat range of 40 to 45 degrees Celsius. So there's no clinical data required to get ILY code. It's as simple as submitting a bench testing showing your device can create heat at 40 to 45 degrees Celsius and not beyond that point. Now, the thing, if you fall within this category, every one of these devices has the same FDA clearance or indication for use, which is the italicized lettering there. Insert device name here. It's going to be intended to emit energy in the infrared spectrum to provide topical heating for the purpose of elevating tissue temperature for temporary relief of minor muscle and joint pain and stiffness, minor arthritis, muscle spasms, temporary increase of local blood circulation.
And you know, just to touch on a point there, Travis, and I know we're going to talk a little bit more about this throughout the webinar, but for those physicians that are listening in right now, when you guys are ultimately looking to invest in laser therapy and bring it into your office, this is why FDA clearances and what's called IFU, which stands for indication for use, is so important. If you're going to purchase a class 4 laser system, which has this specific indication for use, that means you can only market for topical heating and what it's approved for. You cannot market that it treats low back pain. You cannot market that it treats some things that Erchonia can treat, like plantar fasciitis or chronic neck and shoulder pain. You cannot market for these things, and if you do, you put yourself at risk. As well, the companies that are marketing for it are doing it illegally, which we'll get a little bit more into, but just to touch on that point.
Yeah, that's a good point, Dave. I think we touch on it a little bit later as well, but guys, I'm telling you, the FDA right now, they're busy. They got important things with the whole virus situation, but they are cracking down on these class 4 lasers and the marketing claims they're making. I can say in the last year, or since year to date, there's been at least 5 FDA warning letters to 5 different class 4 lasers for misinterpretation of marketing claims. So they're going to start with the manufacturer, then they come to the provider. So this is FDA's website, ILY category. We just put this up there so you can see it. As I said, it started as a heat pad. It went to diathermy. It went to hot lasers. There's 271 devices within this category. That number is much, much more. So FDA actually made this category exempt, FDA exempt. So basically, you don't even have to file with FDA anymore, as long as you have proof on file that you can raise temperature. So this is probably double or triple the number of manufacturers out there with this indication. The second FDA category is NHN. It's a laser-based device having coherence collimated, typically monochromatic radiation. This device emits energy in the infrared or other wavelengths to provide non-heating or non-thermal effect, and is indicated for the adjunct use in pain therapy or related indications. To receive a new FDA clearance within this category and not substantial equivalent, you must provide a placebo-controlled study. And something neat about this category is Erchonia actually helped create and really back and forth communication with the FDA in 2002. Because we didn't fall into the ILY category, we didn't create heat, so they had to create a new category, and that was the NHN, and that was based on our double-blind placebo-controlled study for neck and shoulder pain, which was the first FDA clearance for non-thermal laser. And then as we present on this, you know, it's important for you to know how to navigate through FDA's website. Especially if you're investing your hard-earned money into buying in technology. This takes 1 to 2 minutes to look up the device. It starts by going to fda.gov, click on the 510K pre-market notification. You'll be prompted there at the bottom right to enter the company name. So I put Erchonia as our example. Step 4, you're going to have all the devices under that company name. You can click which one you want to see the indications for use. And then bottom right, you're going to have the device information. A couple of things to look at on this device information screen. You have the classification product code. As you can see, we are NHN. You're going to have to look and see if this is NHN or ILY depending on the company. The other thing is summary. So summary is what you actually want to then refer to for the indications for use, which we'll hit on here in a little bit.
Yeah, so, with this, as Travis was going through that, the differences between ILY and NHN, specifically for the NHN category, Erchonia Corporation owns the majority of every NHN FDA clearance that is out there. Some of the other so-called competitors within that NHN market is Microlite, which I will give Microlite props because they actually did research, which Travis will talk about. The research did not turn out very well for them. It was actually very, very poor results, but they actually put the time and the effort in to do the research. So we have to, give credit where credit is due. And that is indicated for carpal tunnel syndrome. The AccuLaser T Pro 4 is indicated for adjunctive use in providing temporary relief of pain associated with iliotibial band syndrome. Again, at least they did some research to get that indication for use. The Omega XP laser system is intended for use as an adjunctive device or an adjunctive treatment modality to provide temporary relief of pain associated with rotator cuff tendonitis. And then the Theralase TMTLC-1000 therapeutic medical laser system is indicated for adjunctive use in the temporary relief of pain associated with knee disorders with standard chiropractic practice. This was a single blind controlled study. Travis will talk a little bit more about the research and the clinical studies here with these devices, but I will at least give them credit because they put the time and the effort in to do clinical studies to receive these FDA clearances. Problem is, and we'll break it down, the results just were very, very poor. And ultimately, it's going to be hard to prove a good result when the laser is using different things in regards to not true lasers, true low-level laser. They're using things like LEDs, so on and so forth. And then, some of Erchonia's, and Travis, you want to talk about Erchonia, some of the ones that we have in the NHN category.
Yeah, absolutely. So taking it back to what Dave mentioned, the last one there, the Theralase, and how they are indicated for knee disorders with standard chiropractic practice. Basically, that means in their study, they had to use their laser in conjunction with chiropractic to get results. I appreciate the research, but just make sure you're reading that through. Now, keep in mind, when Erchonia studies, each subject has to sign a waiver, our consent form, that says they're not going to have any adjunct therapies, they're not going to take any type of pain relieving drugs, or even things as over-the-counter NSAIDs during the study itself. So these are all based on double-blind placebo-controlled studies. We had neck and shoulder pain, that was in 2002 using a red laser only. And 2019, we ran another study doing red and violet on neck and shoulder pain. So we have 2 indications there. Post-surgical pain associated with breast augmentation, as well as post-surgical pain associated with liposuction, plantar fasciitis, chronic low back pain, and then the most recent one is musculoskeletal pain. So just comparing apples to apples, there's 4 out there in the NHN code with competitors, and there's 7 with Erchonia.
And this is just specific to pain management. Those of you that have been following Erchonia, specific in our aesthetic market, we also have, our Zorona Z6 laser, our Emerald laser, our Luneal laser. So we have aesthetic devices FDA cleared for different indications for use, all backed by level 1 clinical studies, just like our pain side. But today's discussion is going to be specific to our pain management market and the competition within.
That's a great point, Dave. Okay, so we walked you through how to review FDA's website and their literature. The other thing we want to make sure you take time to look at is the actual research. So companies, they're going to provide you with research. Even we as a company will. Take time to read it, review it. There's a lot of misconception out there. So they're sending research that's not based on their technology. Also, there's different levels of research. So if you look at the top there being the lowest quality of research, it's an expert opinion or a case study. The problem with case studies is normally it's one patient, two patients. There's subjective feelings that may influence the study itself. And then it's really hard to replicate that in everyday practice. The highest quality of research is double-blind randomized clinical trials, which is the exact same trials that Erchonia does, the exact same trials that pharmaceutical drugs do, and we'll get into that here in a little bit. Just make sure to actually look and see what type of study it is. Is the study even based on their device? Real quick, a little bit on what a randomized controlled clinical study is. Most of us know this, but it's meaning the investigator or staff or the patient, they don't know if they're getting a real or placebo treatment. As a placebo, we use the same color LED, light emitting diode device. We also do multi-site, so it's normally 2 to 4 separate independent sites per study. That data has to match up. FDA will review it. If one site kills it, the other site fails, they're going to ask some questions and we're not going to get an FDA clearance based on that. They also set the success criteria. So for example, in pain, we have to see at least a 30% reduction in pain, but we also have to have a 35% difference between our test group and then that LED group.
And as we go through this, and Travis will talk a little bit more about this, but going back 2 slides ago, he discussed the different levels of research between a level 1, a level 2, level 3, level 4, and level 5. As he mentioned, all of the research that Erchonia does is level 1 clinical research. As we go through that, keep that slide in mind about the level of research that a lot of these other companies are claiming on their own websites. The majority of them are case studies, and when they're not case studies, they're claiming research and publications have been put out there, not specific to their actual product, but we'll get a little bit more into that as we go.
Yeah, so here we have PubMed.gov. If you just simply type in placebo-controlled trials, if you put in low-level laser next to that, you're going to have 447 results. Class 4 lasers, type that in next to placebo-controlled trials, you're going to have 7 results. I went through those 7. I can personally say about half of those do not apply to therapeutic class 4 lasers. It's actually more for ablasive tissue and surgical use. So some of the statements you will see as we go through the competitors is class 3 lasers are outdated. Research now shows that class 4 lasers are effective. According to PubMed, that is definitely not the truth.
So we're going to go through and break down some of our competitors. As I mentioned, in the beginning of this webinar, we had about 25 different competitors we wanted to go through, but as we started digging into each one of them individually, we're like, okay, there's a lot more here, and we will not be able to get through all 25 of these competitors within an hour time frame because we don't want to keep you guys on this forever. So as mentioned, we can certainly do a part 2 of this or even a part 3 of it, depending on the feedback we receive. But we're going to pick our top main 7 competitors. And when I say competitors, I mean so-called competitors. And I don't say this to be disrespectful in any way whatsoever. When you go to conferences, things like that, all of our sales representatives know this, and they're all have the same verbiage. When a customer comes up to us and asks us and our sales representatives, what is the competition with Erchonia? Who's your main competitor? Pretty much without a doubt, every single one of our sales representatives, and they're not trained to say this, is just something they say because they've seen the research, they know the research. They say we don't have competition, not with the type of product that we manufacture. All of these devices, all are class 4 topical heating devices, and there's no research to back them up, but we'll get a little bit more into that. But the first one we want to talk about is cutting edge laser, and we want to give you the facts. Again, as we mentioned earlier, every single slide will have a reference at the bottom of it and show you exactly where we're getting this information from. Do the research for yourself. So the cutting edge laser uses 2 different wavelengths at 808 nanometers and 905 nanometers. Both of those are in the infrared spectrum. As those of you that have researched Erchonia knows, we only stay within the visible light spectrum between 405 nanometers and 635 nanometers. We do not go outside that spectrum. We do all manufacturing here in-house. For those of you that have been out to Melbourne, Florida, or when we were in McKinney, Texas, and have toured our facility, you'll know that we are 85% self-reliant in all facets of our company. We do all manufacturing here in-house. We have a CNC machine shop that cuts parts from raw materials. We have an assembly department that assembles these, our quality control department, our service department, our sales, our marketing, our admin, our accounting, everything is housed under one roof. The reason I bring that up is we have the ability here to produce any type of medical product that we see fit with all of the ISO, MDSAP, FDA, ISO regulations that we adhere to. And we've decided to stick with visible light spectrum and not go into the infrared spectrum because we've done it. We've tried it. We've researched it. It's not as effective, not even close as effective as the research that shows low-level lasers in the visible light spectrum. And it's a lot cheaper to manufacture those. So it would be much cheaper for us to manufacture a thermal laser system or a class 4 laser system, but we don't do that because we are all into the research and the efficacy that the lasers provide. But getting back to cutting edge, the power output for the cutting edge laser is up to 3.3 watts. All Erchonia lasers range from 7.5 milliwatts to 17.5 milliwatts. A milliwatt is 1/1000th of a watt. So for cutting edge laser to go up to 3.3 watts of power, that is 3,300 milliwatts of power that device produces. Just keep that in mind as we get further into this presentation and we talk about the dangers of high power lasers. Now, the cutting edge lasers, they are manufactured by a company called ASA based out in Italy, and Cutting Edge is the exclusive distributor, US distributor for that specific product that ASA manufactures. If you go to, as Travis mentioned earlier, if you go to www.fda.gov, you click on medical devices, then you click on the actual 510Ks and you do the research for yourself, you will find this here in regards to their indication for use. To make it even easier on you, we put the direct link at the bottom of this slide. If you click on that link, it leads you directly to the FDA's website for the cutting edge FDA 510K clearance. And surprise, surprise, their device is cleared for topical heating for the purpose of elevating tissue temperature for the temporary relief of muscle and joint pain and stiffness, arthritis pain, or muscle spasm, the temporary increase in local blood circulation, and or promoting relaxation of muscle. So Cutting Edge did zero research to receive an FDA clearance. To date, they have not done any research and provided any new indications for use. It's the same old before 1976 heating lamps.
Awesome. So looking at their website from a research perspective, click on their science tab. As you can see here, they had 3 case studies. Again, remember the quality of research there. No blinded controlled studies. I did find they have a scientific journal that they hand out. Initially, it looks impressive. You have over 137 pages. The problem is, again, look at the research. So we're going to just look at a few of these references. The first one being Harvard study. Guys, this is an awesome study. I would advise everyone looking at laser to actually read this. I'll show you a couple issues though where it's published. Introduction. Low-level laser is the application of light, usually a low power or LED in the range of 1 milliwatt to 500 milliwatts. What do you think? That should throw up a red flag for everyone listening. This is a 3.3 watt company showing low-level laser research. And then to take it even farther, you look at the conclusion. Low-level laser therapy delivered at low doses tends to work better than the same wavelength delivered at high levels, which illustrates a basic concept of the biphasic dose response or hormesis. In general, fluences of red or infrared as low as 3 to 5 joules per centimeter squared will be beneficial, while large doses of 50 to 100 joules per centimeter square may lose beneficial effect or become detrimental. So not only are they using a study that's outside of their specifications of a laser, they're actually using a study that contradicts exactly what they're promoting when more energy, more power is needed. So kind of taking it back real fast to the table of context, you have a couple more like chow management, neck and shoulder pain. Another is a pretty good study. The issue is this is visible light, 632 nanometers and 670 and infrared, and outputs of 4 to 450 milliwatts. Again, this is outside of their laser category, and they're publishing it. I guess kind of taking it for granted that you guys ain't going to read it.
And to that point, Travis, and coming from the sales and marketing aspect here at Erchonia, I know Travis comes more from the research perspective, but to me, this is offensive that a company would even put something out there. Almost, and I don't mean to say this crudely, but almost to think that physicians are too dumb or too lazy to even read the research. It's offensive to me that they put something out there that is totally against the product that they're selling. When you're talking about research studies that are between 4 to 450 milliwatts, that's less than half of a watt. I mean, that's way outside of what they're promoting, and it's somewhat offensive that they would put that in there thinking that you guys will not research that. But no worries, that's why we wanted to discuss these things and bring them out today.
Yeah, and even if you look at this study a little bit farther, okay, they're outside the wavelengths, but this study also has a similar conclusion to the Harvard study where they have a optimum dose. So 820 to 830, it should be applied between 0.8 and 9 joules. Investigators who use doses outside these limits did not show any effect of low-level laser. So again, this study, it contradicts everything they're promoting as a company. And then the last one, you have one on bone repair using different wavelengths. This is at 810 at 100 milliwatts, which is considered low-level laser or non-thermal laser, and they're at 3.5 watts.
So the next company to discuss is Radiance, and just to go over their statistics, again, looking at the bottom of the page for the reference, they use 3 wavelengths, 660 nanometers, which is an LED, 875 nanometers, infrared, 905 nanometers infrared. Anytime you get above 760 nanometers, it's in the infrared spectrum. So anything above that, just know that it's in the infrared spectrum. One thing I want to point out is the majority of class 4 laser systems on their websites, they will promote that they're using a red or a blue or a green wavelength, and they will promote the biostimulatory effects of different wavelengths in regards to the results from it. But it is an FDA guideline and requirement that if you are using energy in the infrared spectrum, infrared meaning non-visible spectrum, it's obviously dangerous, and you guys saw the classifications. Now, this particular laser, they are a class 3 laser, but it is dangerous for them to use that device optically. So you have to have a guidance light. You have to have something that the physician can physically see so they know where they're pointing that device. In this case, they use a 660 nanometer LED, and they will claim the same effects as an Erchonia laser at 635 nanometers because they're both red. Now, the problem is, and as Travis will probably discuss a little bit more throughout this presentation, is when we did all of our level 1 clinical studies, our placebo devices, our sham devices, used LEDs. We show a much, much greater effect using true laser over LED. So they're claiming the effects of the red light therapy, but they're using LEDs, and they're only putting it in there because the FDA requires them to as a guidance light. Now, their power output, which is something I'm sure Travis can talk a little bit more about, because they are a class 3 laser, but their power output is up to 50,000 milliwatts of power. They are manufactured in Salone, Ohio, so at least they're a US-based company. If you would, Travis, flip the next slide, please. And if you look at their indication for use, Travis, why don't you talk about this one, because I know you're going to talk a little more about the research side of this.
Yeah, sure thing, Dave. So this is actually a really recent, has to be within the last year or two, clearance for multi-radiance, which is the adjunct use in providing temporary relief of chronic neck and shoulder pain. We received the same FDA clearance 15 years prior to this clearance that we're looking at here. I wish I had their study because, with all due respect, I appreciate multi-radiance as one of the few, actually the only company that we're going to talk about today that actually went out and performed double-blind placebo-controlled trials. So I would love to have their neck and shoulder pain study. I went to clinicaltrials.gov. It's not, the results are not posted as of yet. I do have a study placebo-controlled they performed on knee pain, non-specific knee pain. And this was 12 treatments and then a 1-month follow-up. They did have a decrease in pain over the placebo group of 13%. Kind of going back to that original slide that showed everyone, we have to have at least a 35% difference between our test group and placebo to be considered a study success. So this would be a failure in our eyes. But granted, they did a placebo control, they did get results. Something interesting reading through this study, as you can see, that no changes between real and placebo at 4 treatments. And then you kind of start to see that the gap form between real and placebo. Interesting enough, after beginning with the 5th treatment, they reduced the local dose by 1 joule per site to stimulate tissue repair. Again, guys, this really does back up what all evidence has shown is low power works better than high power. And again, this speaks to it. They also did a double-blind placebo-controlled study on low back pain. They reduced prostaglandins. However, they did not have any outcome or reduction in pain intensity, interleukin 6 or TNF alpha. But the big one there is, okay, they reduced prostaglandins, but they did not have any effect on pain. So here, I took this study because this one, I've been going back and forth with this study with the AMA for the past 2 years. So, or it's been Erchonia's mission to get every physician out there a category 1 insurance code for low-level laser. Because at this point, we've have over a handful of double-blind placebo-controlled studies. We've proven this works. It's not investigational any longer. But the problem is AMA, they pulled data up like this study here. They pulled data up like this one here, which shows that this is a systemic publication just published July 2020 that shows low-level laser or photobiomodulation does not work to decrease pain and disability in with people with low back pain. The problem with this, and this is the battle I've been fighting with AMA, guys, check out the wavelengths. This is 12 studies, every wavelength I've listed there. You have 808 nanometers all the way through 1064. What do they have in common? They're all infrared wavelengths. I'm going to touch on it here in a little bit, but visible light works completely different than infrared. And really to prove that out, it's a double-blind, sham-controlled, placebo-controlled study Erchonia did on chronic low back pain. If you look at this, it was twice a week, 4 weeks. The test group received a reduction of pain of 53%. We submitted this data to FDA and became the first and still only laser to have a FDA clearance for chronic low back pain. So they're, to group all laser into one, it's unfair. Different wavelengths have different mechanisms. Obviously, you can see here visible light works better on chronic low back pain. It's documented. But again, that's still a battle we're fighting with the AMA up to this day.
One thing, Trav, go back to that last slide if you would. Thank you. So one thing to point out, guys, we were talking about earlier in the presentation is the FDA 510K clearance. Because Erchonia has spent, I think this study took us, 8 years to go through from start to finish?
Yeah.
From the very start of the protocol to finish of it?
Yeah.
Before we received an FDA clearance on it. And it cost us millions of dollars to go through the study. But what this gives you guys as physicians out there is it gives you the ability to market your device as being the only FDA cleared device in the world to treat chronic low back pain non-invasively. If you purchase a class 4 laser system, we talked about cutting edge earlier, you cannot claim that you can use your device for chronic low back pain. If you do, you can get in some big trouble. They can come in, they can send you a cease and desist letter because you are marketing your device improperly. Now, you as physicians can use your devices however you like, as you know, off label, but you cannot market or promote it. With the Erchonia laser, like the FX635 in this case, you can market it. So I just want to bring that one point up.
Great point.
And then next we'll talk about the Thor Laser. The Thor Laser is 810 nanometers, 850 nanometers, again, both infrared, above that 760 nanometer range, and 660 nanometers. Their power output is between 10 to 200 milliwatts of power, and they are manufactured in Chesham in the United Kingdom, and then their Nova Thor product, which is their bed that uses LEDs, is manufactured in the United States. Again, we have the reference on bottom there. If you look at their indications for use, once again, surprise, surprise, Trev, why don't you talk about this? Because I know you want to bring in the microlight study, right, on this particular one?
Yeah. So Thor, they actually have a unique situation where they offer a class 4 laser, which is there to the left, or it's more of an adapter that produces topical heating for temporary muscle relaxation. And then to the right, they have what you consider a low level laser that is indicated for carpal tunnel syndrome. Now this is, guys, this is where you kind of go back to what I looked at or kind of went over to start with the FDA. Do your research. They did not submit clinical data. They filed substantial equivalent to Microlight, who used the 830 nanometer laser, and they received the first clearance for the carpal tunnel syndrome. Now, the issue with that, if you actually look at Microlight's study on carpal tunnel, the results are subpar, to say the least. It was 15 treatments, 3 times a week for 5 weeks. I have the chart there to the right, but if you look at Microlight, in any pain reduction, it was 75%, placebo was 69%. So they were basically 6% better than their placebo in reducing any pain. Even if you take that down to 30% pain, they were 15% better than placebo. So very, very minor negligent results at best. So that's why it's best to do your own clinical trials.
Next, we'll talk about the Avant Laser. The Avant Laser uses a 637 nanometer LED. Once again, going back to what I was talking about earlier, LED is required because they also have an infrared spectrum of 808 nanometers. Now, of course, they will claim the LED spectrum as the same effects as Erchonia, which they do. I've seen it out in the marketplace a lot, but they use an LED, which is, again, is our placebo device. And then they also use 808 nanometers in the infrared spectrum. Their power output is between 1,000 and 1,400 milliwatts of power. And again, reference there on bottom. You can do this research yourself. I couldn't find the exact location of manufacture. It just said they were manufactured in California. So they are a US-based company. And then if you look at their FDA 510K clearance, now here's the thing, and one thing I want to touch on, and again, this is, Travis will talk about the research side of it and the clinical side. But from a sales and marketing side of this, I've seen this particular company at, a lot of the trade shows I go to, I've seen them, they'll have a booth, and they will be claiming a lot of effects using their laser system neurologically. You have another company out there, and I don't know the specifics of this, but it's called Shedlight, and that company is, I believe, a distributor of Avant, if I'm stating that correctly. And with this company, their entire market push is to get in the neurological market and ultimately to get with all of the neuro dips that are out there in the chiropractic neurology market. If you look at what their device is FDA cleared for, if you look that they're in the infrared spectrum, the research does not point to that. But their device is FDA cleared for topical heating, just like all of the other class 4 laser systems that are out there.
Yeah, great point. So this is kind of going back to their research perspective on their website. They have a couple claims, one being clinical evidence demonstrates that increased power improves therapeutic outcomes. I would love to see the clinical evidence to support that. Unfortunately, they didn't have anything listed on their website. They didn't have anything published on PubMed, and they did not have any studies open on clinicaltrials.gov.
And Trav's going to go a little bit more into clinicaltrials.gov because that is another fantastic resource. And I don't want to steal his thunder here, but it's another fantastic resource. If you guys are looking at different companies, you simply go to clinicaltrials.gov, type in the name of the company you're looking at, and you can do this for any product, not just laser therapy. You type in the name of the company and you can see what actual clinical studies have been done with that specific product, not what other people have done research on, and you can use their publications and their research. What research has been used with that specific product? And I'm not talking about case studies. We're talking about actual clinical research.
Yeah, it's a great point, Dave. That tool of clinicaltrials.gov, you can see, really examine a company from past, present, and future. So what they've done in the past, what they have open enrollment, and then as well as future studies.
The next one I want to talk about is Lightforce. And actually, when I was looking at the attendee list earlier, it looks like we actually have a Lightforce representative on here. So again, I don't mean to be disrespectful when I talk about this. We just want to bring forth the facts. But with their wavelengths, they use 980 nanometers and 810 nanometers, again, in the infrared spectrum. Their power output is up to 40 watts of power. I know it's variable, but it's up to 40 watts of power. When you look at how much power that device is using, it is absolutely insane and somewhat dangerous. And we'll talk a little bit more about that. Product, from what I found on their website, is manufactured in Newcastle, Delaware. I think it's the main company, LightCure, is the actual manufacturer of it. Lightforce, I believe, is their, I don't know if it's their sister company or just their human pain management market. From what it sounded like, that's their name for it. Now, if you look at their indications for use, one point I want to bring forth here is just for physicians out there. This is why it's so important to do the research, see what they're actually FDA cleared for. So they are FDA cleared for topical heating, just like every other class 4 laser system we've been talking about today. But they also have an FDA clearance for tissue ablation. So the same device that you're using for a therapeutic outcome in topical heating is the same device that they're using for tissue ablation. Just think about that for a minute. And if you actually look at how class 4 laser systems got into the marketplace, most of these companies manufactured devices that were surgical lasers in the infrared spectrum, super high powered. When they found out that they can claim substantially equivalent and receive an FDA clearance without doing any research, meaning they don't have to put all the time, the resources, and the money into doing research, they can just submit information to the FDA and receive an FDA clearance to market to physicians such as yourself. That's when they took their surgical lasers, they changed the optics on the end of it, so it's not focused energy, it's a little bit more spread out to create topical heating, just like diathermy, just like heating lamps. Then they received FDA clearance based on that. And ever since that happened, that's why there's 271 devices, as Travis went through earlier, that have the ILY product code through the FDA, because it is such a cheap and easy way to get in the marketplace. And if you throw enough money into marketing, well, then we can, in their mind, fool physicians into thinking our product is a true low-level laser, which it absolutely isn't. The last one that they have FDA clearance for is for onychomycosis, for temporary increase in clear nil. And that just shows you that this device is ultimately, they're trying to use the same device to treat every aspect. If you can't do one thing good, why try to do 3 different things good? That's the way I look at it.
Yeah, so I was excited looking at Lightforce originally. This is right on their homepage. First thing you see, they're grounded in scientific evidence. So let's kind of dig into it and see what they have. One of their things they have to offer is faster treatment times. So higher wattage also results in faster treatment times and provides changes in pain complicates. So kind of digging into their website, here's another study they offer. Now, granted, this was done with a completely different device, actually going back to the ASA manufacturer that Dave mentioned earlier, but it's on rotator cuff. Their protocol is 12 treatments over 4 weeks, 15 minutes per session. I'm going to now compare that to Erchonia's protocols, not that we're just writing up, but that we've actually submitted to FDA and received FDA clearance based on level 1 studies. Neck and shoulder pain was 1 treatment, 13 minutes. Plantar fasciitis, 6 treatments, 10 minutes apiece. Low back pain, 8 treatments, 20 minutes apiece. This is a perfect example, guys, not to take everything at face value. Dig into it. I don't know. I don't see how 12 treatments over 4 weeks, 15 minutes per session is any quicker. Actually, it's quite a bit longer than all of our proven protocols. The other thing you'll see there within the research on the website is the kind of typical depth penetration video. So this shows that class 4 laser is penetrating deeper than a class 3 laser. You'll see this almost basically every class 4 laser website. They're not only power, but also wavelength. So the top right picture there, you have 700 nanometers red laser, really only penetrating into the dermis. These are great pictures. I couldn't create this in paint if I tried, but where is the validated evidence to back it up? And that's where Erchonia is. We've done the research, we validated this, we've proven that is a complete myth. So really, this goes back to 2002, published in the American Journal of Cosmetic Surgery. We lasered just 6 minutes with a handheld laser, and after 6 minutes, the superficial adipose layer and the adipose tissue is much more coalescent. So if you look at the top left-hand picture, that's pre-laser. Bottom middle picture is post 6 minutes. You can see that laser penetrating and emulsifying fat at 6 centimeters deep. So I'm not sure how we penetrate 8 millimeters and then somehow prove 6 centimeters here. But we've also validated that for a second time. Dr. Klitschko Machado, world-renowned neurologist out of Cuba, he just took the Erchonia laser. He lasered the vagus nerve or vagal nerve. He then did QEEG testing, so brain scans. He come to find out you can laser the vagal nerve, create systemic effects, which we've already known, all the way into the brain itself. So that completely destroys any type of myth on depth of penetration. We're not even lasering the brain and we're getting a response in the brain. And then third, and really the most important validation that Erchonia has done is FDA clearances. So these are backed by double-blind placebo-controlled studies. We have neck, shoulder pain, plantar fasciitis, low back pain, non-invasive fat loss. Non-invasive fat loss in obese patients. Take something as simple as post-surgical breast augmentation. This was submuscular. We actually cut the breast, lifted up the tissue, the muscle, inserted the implant behind both of those, sewed it back up, and then laser. So we're not only lasering through tissue, we're lasering through muscle, as well as post-surgical liposuction. So like the breast augmentation, how the implant was now treating tissue, muscle, we're actually treating behind that. We've also proven this through post-surgical liposuction. So all these conditions here are deep-seated, well beyond the dermis. Then if you take it to indications for class 4, it's topical heating for the purpose of elevating tissue temperature. So I have a question, and I'll kind of leave it unanswered at this time, but what laser really has the deepest therapeutic response and which one is affecting the dermis?
And I'd like to just kind of go back to, and it's just how my mind works, go back to common sense. When you think about what laser therapy is doing and compare it to other, I guess mainstream medicine that's on the market. If you think about something like an NSAID, we're taking NSAID orally, the body's processing it, and we're having an effect somewhere else completely opposite of taking it orally. We may be having an effect within the hand or the foot or the shoulder, whatever it may be. That's because it is creating a chemical reaction within the body. Laser therapy is doing the same thing, but it's a photochemical reaction, which is why Travis is going to talk a little bit more about the absorption. But I just like thinking of it that way. You don't ask the question, okay, I took that NSAID, how deep did it penetrate into my body? No, I took that NSAID and it has a chemical reaction with my body. Same thing with laser therapy. I lasered and it's having a photochemical reaction. You have that systemic reaction within the body, same exact processes that are happening within the body. The great thing with laser therapy, though, is we can point it directly to the area and we completely avoid messing up the liver because we're going directly to the area and it's much safer.
Yeah, good point. You actually stole the thunder a little bit there, Dave, but that's all good. This would be a quick slide then. First law of photochemistry, how is that possible? How are we treating in penetrating to these deep-seated pain, our effect, I hate the word penetrating, how we affecting these deep-seated pain conditions. It's because the first law of photochemistry states that states that light must be absorbed for photochemistry to occur. So simple, common sense. If the laser is penetrating and is not being absorbed. And then Tina Crew, she has some great research articles back in the day. This kind of goes hand in hand with what Dave mentioned, but low intensity visible light. It's not appear to absorb light directly. The cell membrane appears to be the primary absorber of the energy, which then generates intercellular effects by the means of second, messenger, or the cascade type response. I could have a whole webinar just based on this one slide, but probably not the best time and place for it.
So next we are going to discuss the Aspen Laser. The Aspen Laser uses 3 wavelengths, 810 nanometers, 980 nanometers, 1064 nanometers. So again, all within that infrared non-visible light spectrum. Their power output is 15 watts of high power with each wavelength for a combined total of 45 watts. From what I can find on their website, it didn't specifically say, it sounds like they've moved around a little bit, but manufactured in Denver, Colorado. Just a funny story, something that came up recently. One of my representatives was at a conference this past weekend, actually here in the United States, and Aspen was at the conference as well. And the representative that was there, I don't know if it was someone in their management side or whatever, but was trying to get our representative to come work for them because of the knowledge that our representative had in laser therapy and how successful this particular representative has been. And, our representative pretty much just said, I'm sorry, I'm not interested. I want to work for a company that has validated, efficacious products. And that's with all of our representatives. Anybody who's worked with Erchonia, you guys know that our representatives are very knowledgeable in laser therapy. They're not just someone there to sell you a product, they're there to educate you on it. And then ultimately you can make your informed decision if this is the right product for you. If you look at their FDA 510K clearance, same old story. Topical heating in the infrared spectrum, raising tissue temperature, the same thing as every other one of these class 4 laser systems. So I don't think we need to beat a dead horse in that regard.
Yeah, not much to talk about on the science portion either. This is a snapshot off their website, all case reports, no placebo-controlled studies, so we'll kind of move on from that.
Well, Travis, just go, if you would. Yeah. And earlier when Travis was talking about the 5 levels of research, again, there was even a reference on that where you can search the 5 levels of research. It's out there, you can Google it. Every one of the things that they put on their website, as Travis just mentioned, are case studies. A case study is the lowest form of research. There is so much subjectiveness in it. So how can you claim this as being proper research that the device is doing what they're claiming? And by the way, they're claiming things like shoulder pain or tendonitis, things that they do not have FDA clearance for. So you as a physician cannot market for it. So I just want to make that quick point.
Yeah, and to add on, because honestly, I didn't even really look at this page, but so here you can see, look at that second column, neuropathy diabetic. Guys, we are running a FDA level 1 study right now on diabetic neuropathy. They are approved for topical heating for temporary muscle relaxation. This does not fall into neuropathy at one bit. And actually, I can say every FDA warning letter that went out to a class 4 laser over the last year, you know what topic they hit on? It was neuropathy. So you got this company, but if you guys are out there with this device advertising neuropathy, just be wary.
Now, next this is our 7th one, and we're over an hour now. So this will be our last laser system we're going to talk, but then there's a few other points after this. The reason I want to say this one for last is I kind of had a few questions myself and wanted to find out what the answer was. For those of you that have seen K-Laser in the marketplace, they've been around for a little while. Well, just here recently, not too long ago at all, they changed their name in the United States. Now, I know we have a lot of international partners on this webinar as well. But in the United States, they changed their name to Summit Laser. So for me, I'm like, well, if you have a good brand and a good name, why would you change your name? It just did not make sense to me. So I started doing a little research, and it was not hard to find. Before I get into the next slide, which will break this down a little bit more, their wavelengths, they use 650 nanometers, 810 nanometers, 915, 980. So they only have the 650 in the visible light spectrum, Once again, it's an LED. It's required they have it as a guiding light. Their power output is up to 24 watts. That is 24 watts, not milliwatts, so insane amount of power. And their product is, and we'll get a little more into this, is now manufactured in Hubei, China. So just keep in mind when you're purchasing a product, are you looking for something that's manufactured quality? Are you looking for something that's going to be there for the long run? Are you looking for something that's made very cheaply? We'll get a little more into that. So with their, Trav, do you want to touch on this one?
No, go ahead.
Okay, perfect. So with their FDA clearance, just as you'd expect, it is for topical heating, just like every single other class 4 laser system out there. Now this, I do not want to draw any conclusions in our physicians' minds that are listening to this webinar right now. I want to put the facts out there and I want you guys to go do the research for yourself. It was a little bit disturbing when I actually found, and it's like I said, you could just Google it, but I put the direct links to the websites here. So the company K Laser is a manufacturer. They are based in, I believe it's in Italy. You had K Laser USA, which was ultimately the distributor in the United States and Canada for the K Laser product manufactured in Italy. So there was a huge legal battle that went on between the two companies, which is ultimately what forced K Laser to change their name to Summit Laser. When you go on their website, they tell you they changed their name for all these different reasons. But if you look at it, there's actually a legal battle, and it's on K Laser, the actual manufacturer, again, based over in Italy. It's on their website. You can view all of this. It's got all of the reports from the actual lawsuit. And I highly recommend if anyone on this webinar or anyone watching the replay link is looking at purchasing a Summit Laser system, go and just check out these two links. It'll totally change your mind. I would never personally want to work with a company who has done some of the things that K Laser has done. So check it out. I just want to read some of the key statements that I saw. It's very long, so check it out. These are some of the key statements. Summit Medical Laser LLC at the beginning was known as K Laser Therapy LLC. Now this is actual K Laser in Italy. This is their statements. LLC founded by Dr. Richard Albright, and then later it changed its name in K Laser USA LLC as an exclusive distributor for USA and Canada of LTech K Laser SRL for the K Laser products made in Italy. The distribution agreement with Summit at the time K Laser USA LLC was terminated by LTech K Laser in February 2018 when we found out that K Laser, in violation of the agreement, had affixed the K Laser mark to a new made in China product not manufactured by LTech K Laser. More precisely on the laser device called Platinum. So if you guys recall, and I had no idea this was all going on, but I remember when K Laser came out with their Platinum line and they had the K Laser stamp on there, now we know the reason why. Stating that it was a new K Laser device model of higher quality. Well, if you look at some of the stuff and in regards to the quality, it's a little scary. But and this statement was from the actual lawsuit. On December 18, 2017, K Laser USA signed an exclusive distribution agreement with Payun to distribute Payun's P1 lasers worldwide medical and veterinary markets except China. So this is the new Chinese distributor. The Payun distribution agreement included both private label branding provisions and the original equipment manufacturer OEM provisions. So just showing that they went over from devices made in Italy to now devices made in China. But again, I do not want to draw any conclusions in your mind. I want you guys to go research this. So just check out the links and it'll lead you right to exactly what happened in this particular situation.
Awesome. A couple of final takeaways then, since we're wrapping up here, is hopefully the next couple of slides really draw everything and then combine it into one small picture for you. The first, companies, and this is almost every company, they're using the word photobiomodulation. I really try to not use this term and stay away from it as much as possible. It's a catch-all. What I mean by that, let's read the definition, being light therapy that utilizes non-ionizing forms of light sources, including lasers, LEDs, broadband light, and that in the visible and near infrared spectrum. It's still a non-thermal process. So class 4 lasers that use the word photobiomodulation or use research of photobiomodulation, it's total out of context. But kind of taking it back to the catch-all portion. So let's look at lasers versus LEDs. To the right there, we have the 6 double-blind placebo-controlled studies that we submitted to the FDA for musculoskeletal pain. So that's 419 subjects. The test group received a reduction of 45% reduction in pain compared to the placebo of 15%. What does that tell you? Lasers and LEDs should not be created equal, and they shouldn't be grouped in one term. And really, to take that even farther, let's take the next section. So this is visible light and near infrared spectrum. This is a really good article from the Stanford University School of Medicine. Although visible light can produce photochemistry, infrared radiation only produces molecule rotations and vibration. So visible light equals photochemical or photochemistry, infrared, photophysical or photothermal. So again, guys, this is 2 completely different mechanisms. You know, consider NSAIDs versus Tylenol. Just because they're both in the pain reduction model, does that mean they're the same or work the same? No, they work completely different. They reduce completely different cytokines, 2 completely different indications for use as well. And then the last thing from a research basis, so we know these companies they're making a lot of different claims. Yeah, that's going to get you possibly in trouble if the FDA looks at your website. But the thing you don't want to do is you do not want to put your patient in risk. So this is it's a great study out of the University of Johannesburg, 635 nanometers. They use doses of half a joule up to 16 joules. And they come to find out 5 joules per centimeter square increase cell proliferation and cell viability. The problem was once you got up to 10 to 16 joules, you actually create cytotoxicity and DNA damage. This bottom, so under that line there, this is what I want you guys to take away today. They were using a 3 milliwatt laser. They had to spread that 3 milliwatt laser over a divergent beam so it wasn't as harmful. So you were not creating DNA damage. 3 milliwatts. Guys, we were looking at 40 milliwatts. Take 30 milliwatt or 30 watts, sorry. That's 1,000 times the power of this study. They're creating possible DNA damage. So again, make sure to read the research. Don't just take everything from a manufacturer's point of view. I hate to get yourself in trouble or even injure a patient.
And then, the last thing we were talking about this earlier, another resource to search is clinicaltrials.gov. We alluded to this earlier. If you look at the 7 competitors that were listed in this webinar, there has been a total of 15 clinical studies by these 7 competitors. And these are studies, as Travis mentioned, this is a great resource because it not only shows current clinical studies that you're doing, it also shows past clinical studies that have been done. So with our 7 competitors, all of them combined have only done a total of 15 clinical studies. Erchonia has a total of 34 clinical studies listed on there. Check them out. Go www.clinicaltrials.gov. As I mentioned on the top right corner, type in Erchonia or type in, K-Laser or type in, Aspen Laser, whatever it may be. Just type in the different lasers out there and you'll see what actual clinical studies they've done. It's very important for you guys to do the research for yourself. We put this webinar together because we don't want you to take our word for it. Don't take our sales representative's word for it. Do the research for yourself, and we know that you will come to a clear conclusion of which laser that you want to invest in because you want good outcomes and you want safety in your office. You don't want to harm patients, as Travis just mentioned. Another thing that I like to point out, when you're looking at competition out there, is education. We have been known for years as not only being a research-based company, but also being an education company. We don't put our money and our focus into marketing and into trade shows. A lot of you that have seen us at trade shows, we do a few of the larger trade shows per year because our customers want to see us there, but we don't throw all of our money into that. What we do is we like to educate all of the physicians out there on low-level laser therapy with the top speakers in the country. From now until the end of 2020, we are hosting 45 educational webinars, such as this one. And that's a mix of live events, webinars, and virtual seminars. Year to date, and this is in 2020 with COVID-19 going on, just to show you how much education that we do. We have hosted a total of 56 webinars, and we average 85 live educational seminars per year. That's year to date. And then we have an additional 45 coming down the pipeline for the rest of 2020 during COVID-19. I did the research for myself. Again, do it for yourself. I put all the references on the bottom right side there. All of our competitors listed on their websites have done a total of listed on this webinar, 7 total competitors have listed on their websites a combined total of 52 educational events and webinars they have hosted and are planning to host. So that's from 2019. I put ours from 2020 to date, and then till the rest of the year. That's from 2019 all the way until December 2020, a total of 52 educational events between all of them. And a lot of them are doing trade shows, not seminars, because they're looking to get leads. They're looking to ultimately sell customers through marketing. They're not looking to educate physicians. Erchonia is all about the education side of it. So I do like to point that side of it out as well. As I mentioned earlier, Erchonia Corporation, we do everything here in-house. So 85% of everything we do is housed under one roof. Some of the additional things that we do, we cannot manufacture in-house here, like some of the circuit boards or the circuitry and components, but the majority of everything we do is in-house. If you guys have ever received a mailer from Erchonia, we even do our mailings in-house. I mean, we have everything under one roof. It's all in Melbourne, Florida, and we invite anybody on this webinar at any time. And I invite our competitors. I see a few competitors on this website. I invite you guys, if you're down in Melbourne, Florida, we will give you a tour of our facility. We want to show you what we're all about, how we're family owned and operated, and we stick by the same guidelines that have led us to where we're at now. We wanted to list our contact information on here. This is not a sales webinar. We don't want to discuss pricing, nothing like that. We wanted to give you guys facts. If you have any questions whatsoever, feel free to call or email myself or Travis Salmons. We will be more than happy to answer your questions. From our competitors that are viewing this webinar, if you have questions and you want a discussion, we're more than happy to. For all of our international partners, if you email me or Travis, Travis can answer your clinical questions. If you have questions about some of our product lines, I can send you to our international partners. So Travis, anything else you'd like to add?
No, I appreciate everyone joining in.
Yeah, we really appreciate you guys. And unfortunately, we've gone 17 minutes over. We don't have time to do Q&A today, but send those questions in. We'll be more than happy to answer them one-on-one. We appreciate it.